Want to get rated good or outstanding under the new CQC assessment framework? Then pay close attention, because this isn't just about paperwork anymore. They want to know what your clients actually feel, experience, and say about your care. I'm Millie from CareSync Experts, and in this video, we're breaking down exactly how the CQC measures people's experience and what you must show to stay inspection ready. In the new framework, the very first category is evidence of people's experiences, and for a good reason. The CQC believes the most reliable indicator of quality is not what's written in your policy, but how people describe the care they receive. That means your inspection starts with one powerful question: what is it like to receive care here? Their answers shape your rating. It's personal, it's powerful, and it's what matters the most. To gather this evidence, CQC goes straight to the source: service users, their families, and those who speak on their behalf. Here's how to collect your data. Phone calls or emails to your clients, and only if you've submitted a proper contact list with clear consent. There's also surveys, including online ones sent directly to families or your clients. They also speak to community organisations and advocates, especially for those with limited capacity or communication needs. They also review public reviews on sites like Google, homecare.co.uk and Trustpilot. And lastly, feedback from unpaid carers. An example of this is family or friends actively involved in their care. Everything counts with CQC, from formal complaints to passing compliments. CQC is listening for specific themes, such as: do people feel safe? Are they treated with dignity? Can they express concerns without fear? And are they supported in line with their preferences? And most importantly, does the lived experience match the claim in your statement of purpose? Here's an expert tip. A service user saying they always knock and wait before coming in is evidence of dignity and respect, and that's gold for inspections. Now let's focus on you. What do you need to have in place to meet this standard? Here's what an inspection-ready provider should be able to show, confidently and clearly. Number 1 is feedback logs. Keep detailed records of every piece of feedback, positive, negative, or neutral. Each entry should include the date, the source, for example, a daughter of a service user, the summary of feedback, a theme tag, example, communication, timelines, and actions taken. Here's some examples of evidences of actions. Don't just collect feedback, show how it led to real change. For example, after concerns about late visits, we adjusted rotas to give staff more travel time. This shows responsiveness, not just record keeping. Next is inclusive engagement. Your feedback process must include everyone, especially those with additional needs. This means easy-read surveys, symbol-based tools, video or audio feedback options, and input from advocates where necessary. Another important question is: are you proactively asking families for feedback, or only reacting when something goes wrong? Record their views and, more importantly, act on them. Where a service user has additional needs, still make sure they know how to complain, where to go for help, and that their voice matters. Use large print, picture guides, or translations where required, and review these regularly with the client. Here's an expert tip. CQC loves when providers can show. We created this easy-read complaint leaflet after a client with dementia struggled to understand the process. Additionally, if you really want to stand out during your next inspection, use these tools to capture and present people's experiences. The first is evidence logs. A shared dashboard or spreadsheet where every feedback item is logged, color coordinated by theme, outcome, and next action. Next is feedback dashboards. Track trends over time, for example, communication and complaints, and many more. There's also visual reports to help you tell clear stories to inspectors. Next is QR codes and surveys or SMS links. Place QR codes in the office, client folders, or even staff badges. And keep forms short and mobile friendly where a mobile phone is utilised. Partner testimonials are equally as important. Formal letters or emails from professionals such as GPs, OTs, or social workers praising your responsiveness to care delivery. And lastly is monthly feedback summary. These can be one-page overviews such as what was said, what you did, and what changed. Attach this to your continuous improvement plan and show how people's voices are driving service improvement. With all that said, even the best providers can fall into these traps. Avoiding them could be a difference between good and requires improvement. Mistake 1, only sharing compliments. How to fix this is log and learn from complaints, as they're proof that you listen and improve. Mistake number 2 is feedback collected but doing nothing with it. Fix this by always showing what changed. Every piece of feedback deserves a visible action. Next is overlooking clients with complex needs. Fix this by using advocates, alternative communication methods, and adjust methods based on ability. The next mistake is feedback being scattered across emails, paper, notes, and WhatsApp. Fix this by centralizing everything, ideally in a secure digital log. And lastly, staff being unaware of feedback themes. Build a feedback culture, share lessons learned in staff meetings, handovers, and supervisions. Ultimately, the CQC wants one main thing. They want evidence that people feel safe, respected, and heard whilst under your care. If you can show clear, inclusive feedback processes backed by action and outcomes, you're not just inspection ready, you're leading by example. If you need further expert advice, why not visit us on www.caresyncexperts.co.uk or get in touch with us via email at hello@caresyncexperts.co.uk. Thank you for watching, and make sure you like, comment, and subscribe.